Good evening and welcome to Mental Health Matters After Hours with me, Dr. Audrey Tang. Now, my co-host today, it's not Judith or something, not just morphed into somebody else. It is one of our favourite resident experts. It's Dr. Gus Chaves, and we are going to be talking about staying on track with the changes that you're trying to make, because we know at around this time we all sort of start falling off the wagon. But first of all, welcome back to the show, Dr. Gus.
Thank you for having me back. It's always an honor and a pleasure to be here.
It's our pleasure as well. It's great chatting with you, and we love your expert voice as well, because you're very supportive. And one of the hardest things, I think, when you've fallen off the wagon, you get all of these critical, angry voices, and it's just nice to have a bit of a change from that.
Thank you. Thank you for that.
Now, we're going to dive straight in. You work a lot with change, and you work with weight loss in particular, and that is quite a bone of contention for a lot of people. It's a very difficult change to make. What about when somebody, they want to change, but they don't know they need to change? How do we help somebody without hurting them?
So we have the tendency to think that we have the right to point fingers and just say, I think you need to do this. And what I've learned way before I became a hypnotherapist is that it doesn't work. It doesn't work. People don't like to be told what to do. And I believe the best course of action when you see somebody struggling with something or needing change and you've spotted it, it's finding a way, a comfort, there's so many variables in this. What's your relationship type? Do you get along well? Do you mean well? Are you being judgmental when you're trying to change? And are you, so that all that, sets a bit of the scene. But the important thing is to be compassionate about what they're going through. And I believe the best way is to be scientific, but make them become scientific. When I say that, is science is based on questions. So I believe the best way is to start very politely, very discreetly questioning some behaviors they have. So that they can come, to the conclusion that they might need some change.
That's a really nice way of actually triggering understanding, in fact, because it brings me to my next question. So many people will go to seek help and they'll say, oh, my mum told me, my wife told me, my husband told me, somebody else made me do it. And that's not the right mindset for change.
No, and it doesn't work.
Simple.
It doesn't work because I think how can I say this? The minimum you need to change is wanting to change, the desire to change. There has to be some intrinsic motivation. So to have somebody tell you that you need to change something and then you go to a therapist or a counselor or whatever it is to look for help without knowing or wanting that change, it won't work. So as a therapist myself, as a hypnotherapist, whenever I have patients come to me in that circumstances, I change the approach. So instead of saying, okay, they want you to change this, but what area of your life would you like to make improvements on? And this way you give them the opportunity to see if there is any change they would like to, in any other area of their lives, not specifically the one they told him or them to change. Because this way you're starting to, how can I say, stick your fingers in their intrinsic motivation, what's actually, is important to them.
Yes. And
just setting the scene clearly. What is your role as a therapist or, a health practitioner or mental health practitioner, and what's their role within this relationship, this partnership that you're creating, and be realistic about the outcomes. What you could expect from, working together. This way they can start to visualize how they could benefit from this.
That's beautiful. But you have a fine line to tread because you were a GP as well, which means that at some point, I guess you would have had to have done the, will I advise you to blah, 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 blah. How do you balance that? Because what you're saying is so right and so helpful to getting people to understand what I need to do for me or what I want to do for me. But when we go to a GP, they'll just say, do this, do that.
It's just that science is based on questions, and we tend to see like statistics.
Yeah.
So we have a 95% improve with this. There's still 5% that don't.
Yes.
So there's this one size fits all kind of mentality doesn't really work, especially in the mental health, area, because people are different. So they respond to things differently. That's why we have so many different ways to approach mental health. There's so many different mental health practitioners out there. So because they have different approaches to it. So it's not one size fits all. That's what we have to remember. And people are different. And you have to respect that. Until we're trying to, like, as a GP, what I used to do, since you mentioned it, is just trying to understand what mattered to them first. Yeah. So if for them was, oh, I love my weekends barbecues, I would use that as the motivational part. So would you like to continue having those? Great. So during the week, maybe you should look at some other changes so that you can still have that on weekends. And this way, the medicine, the changing lifestyle makes more sense instead of just do it because you need it. Yes,
yes. But the other thing that makes sense, which we never really think about, is that use of statistics. Your use of science was beautiful because it was 95% of people respond to this. You might be in that 5%.
Yeah. They still exist.
Yeah, yes. And they actually seem to exist a lot on our show because we hear about this when people explain their lived experience. They are that 5%. Yeah. So that's never even thought of that. Never thought to reflect on that. So this is why we need you on this show. Now, what about the situation where somebody has come to you, they want to change, they have that motivation, but their focus is not on the wrong thing, I don't want to say that, but their focus is misplaced. So they will say something like, oh, I don't know, if I just lose weight, I will suddenly be happy, everything will fall into place. It might not be that, that's the focus. You know how people say, oh, when I get a car, I'll be happy. When I get a job, I'll be happy. That's not always the way. How do you...
And it's a very common theme.
Yes.
Because most people that come to me just come very straightforward and say, I need to lose weight. And then where we start to work already, like you don't need to work to lose weight.
Yeah.
You want, apparently, to lose weight.
Yes.
And then you start to go, why?
Yeah.
And I think it is easier if you think about it, to project the things you don't want to change inside to external factors.
Yes.
So when I get this, I will.
Yes.
But the fact that you don't want to work on being today so that could come.
Yes.
Because internal shifts, putting yourself in a vulnerable position, exploring your inner self, your emotions, your patterns, your behaviors.
Yes.
It hurts.
Yes, yes.
And it's a difficult path to, go down, but it is the only one that's going to allow you to achieve change. And maybe get the car, get the body, because that's always going to be too far away for you to get until you change inside first. So you change your inside perspective or approach or patterns so that you can see things differently. It's never external factors.
Yes.
It's a way to just project, but you are struggling to change.
But that's a really good point that you make there, that it is something deeper that's going on. Because what I see a lot of is someone will say, oh, when I get the job, I'll suddenly be all right. And then they'll get the job and they're not all right.
Yeah.
But then you can't say, well, I told you so. It's a really difficult conversation to have with someone. It's almost about, how do you open that conversation with somebody about saying, let's look deeper?
It depends on the person.
Yeah, true.
As I said, anything that you suggest, it sounds like you're telling them what to do.
Yeah.
So I always go back to the questioning. So if you get the car, do you think as soon as you get the car, what's going to change inside of you? I'm going to feel this. Can't you just feel that today?
Yeah.
How can we feel that today?
Yeah.
So we can bring them back to today, because people tend to just throw into the future so they don't have to do anything today.
Yeah.
It's like, listen, if that's the goal, what are you doing today to achieve that?
Yeah.
So let's start in, the inner part of you first. There's also a concept, since you were talking about, because this is very much, I think it's UFO way. Have you heard of this? No. Underfulfilled overachiever.
Oh, I love this.
So they tend to externalize all their goals.
Yeah.
And it's never
enough. Yeah.
Because when they get it, there's something else that they need.
Yes.
So that can be happy, fulfilled.
Yes.
But the void is still there.
Yeah.
And that's the expression I've read recently, UFO way. I was like, oh my God, I could relate to that back in the day where I was just studying and getting the best grades.
Yeah.
And I was like, this is not really giving me the things, the fulfillment that I want. And then you kind of have to stop and reflect, and how do I change that first?
That is resonating so much with me right now, because I'm, going through, we all go through our own process of working through, and I know that I am at that, my brain says, do this, do that, do the other, but I don't stop and think, well, how is that going to make me feel? And what I'm doing now is I'm doing a lot more of, okay, well, how do I feel right now? What am I feeling? And the way I can probably best explain what I do is my brain tells me, you don't like running, you don't like exercise, you don't like any of those things. And I went on the treadmill at the start of this week, and I stopped my brain or my mind, and I started saying, okay, well, how am I feeling? Really, just take the thought process out. I'm feeling fine. I'm okay on this. I don't feel crampy or out of breath. I'm okay. And in doing that, I realized that my mind was totally off on one. And that's the thing I listen to. And the more I listen to it, the less I actually understand how I'm really feeling. It was just such a revelation. So I love that UFO.
Yeah, I do relate to it.
Oh my goodness.
I can relate.
It is brilliant. It is brilliant. And so I do say to people, if you are, I'm very much the cognitive person. Just stop and ask yourself, how am I feeling right now? And it really is working. I'm a work in progress.
Another thing is that when it comes to making change, we have two things that we tend to see as one, which is mind and brain. The mind wants the change. So we're, always looking for something to change or how to implement it. And the brain's all about conserving energy.
Yes.
So the brain's like, we know how to deal with this. So don't go out of your way. This is working.
Yeah.
Even if it's not the healthiest way to do it, it's working.
Yeah.
So it's gonna always pull you back to the patterns you have, and the mind's still struggling to make the change. So that's where you have to at some point merge and say like, okay, the new habit is this one, and I'm gonna keep it because it makes sense.
Yes.
And little by little, the brain gets to accept it. And then change it.
I love that. That's actually the missing piece. This is brilliant. It's like a whole therapy session for me. No, I would love you, Dr. Gus. Seriously, you explain things so well. And so, what about the person who knows they want to change, they have the motivation, but because maybe it's not the time for them, or that's what they perceive, they live with it. And so again, an example of this would be the person who boils the kettle to fill up the bath because they can do that and they're not going to get their boiler fixed because it's fine. I can live with that. How do you change the I can live with it?
I understand the scene that you're setting for me to see, but I can see it in two different ways.
Okay.
There's either somebody has lack of knowledge, lack of self-worth, lack of self-love, or just don't know how much they're deserving of more, or don't know there is more out there, that it could be a change.
Yes.
That's a negative aspect of looking at it. And the best way to approach it is, again, go back to the questioning and being very compassionate about why they're doing this. Do you think that's the best way? Do you think that's a better way? How could it be better? And by giving them the chance to imagine a different scene, they might come to the realization that some changes could be put in place. And the other way to see it, like live with it, which is a positive way to see it, which is not exactly the scene that you painted out, but there are some changes that we want to make that are not up to us. Like you need to go through therapy because you need to change.
Yes.
And living with the people and circumstances that are
Yes.
out of your control actually shows that you're quite evolved
Yes.
in a way to accept the things that you cannot change.
I like that. So I guess in the kettle scenario,
The kettle scenario is the first one, it's the negative one.
or it might be that you've called the boiler person
And you're still
and they're
waiting.
just still waiting.
Yeah.
And so for now, it's
We live in
okay.
it's okay. She found a way.
Yes.
She's accepting the circumstance, and she doesn't see it as a forever circumstance. It's a
Yes.
right now. This is what I have, and I have to accept the situation, which is mind blowing. If you get to this stage, you're great.
Yes.
But you still have to focus on what you can do.
Yes.
And in that scenario, you could see it as a positive.
Yes. Yes.
Okay,
So
she found a way to accept the situation, and she's making it work.
yes.
Great.
Until that point.
Yeah.
But that is, again, it's all about living in the present and what we can do right now. That's the theme of everything that you've said. It's about coming back to now and how we feel now and what we're going to do now and what now means to us.
Yes. And what you can actually do now, because if it's raining, it's raining. And
Yeah.
it is raining. You have to deal with the fact that it is raining. You cannot change weather yet. Technology has its advancements, but accepting what you cannot change and focus on the things that you can, and getting rid, just of what you cannot change and accepting it, allows you to just live a bit stress-free.
Oh my gosh, I love this conversation. We're keeping you, Dr. Gus, and we're going to hear now some tips from our other guest experts.
Answer this question: why do you want to change? Why do you want to? Do you want to change for yourself, or for anyone else? If you want for yourself, then obviously okay, I want to change because, let's say, I want to feel happier. What makes you happy? So the more you keep asking why, after every time you answer another why, and you come to the answer, and it's so much deeper than what you probably would think. So it's always asking yourself, why do you want to make this change, and who do you want to become? If you make this change, what do you think is going to happen? And do you have it in you to make that change, as in go from where you are right now to where you want to be? It's not going to be an easy journey. Do you have the energy and time? Because also when we jump and make these big changes and we don't follow through, it ruins our confidence in so many ways you never think possible, and we feel like failure. So you need to be realistic. And no day is going to be the same. So sometimes, like we go through menopause and periods and all that stuff, one day you have all the energy in the world. Next 3 days you're in bed crying and sulking. So you need to give yourself grace. Remind yourself which phase of life and state of life you are in, and then take action accordingly.
Welcome back to Mental Health Matters After Hours. I'm here with Dr. Gus Chaves, and we are talking about how we can make the changes that we want to make, how we make them stick, how we even start doing them in the first place, and all the things that can throw us off course. And that's kind of what we're focusing on in this little segment here. Let's talk about some barriers.
Yes.
Now, this can happen when somebody is, again, they have the motivation, they know what they need to do, they know how they need to do it, but they're overwhelmed and overstretched. And they almost say, oh, it's okay, I can add that on the end, but it's almost too much for them. How do we help somebody in that situation?
Being very compassionate of what they're going through, because normally it's a pattern.
It's the patterns
It's a
again.
pattern, yeah. We are a whole bunch of patterns, and then we call it personality. But
I love it. I'm going to call it patterns from now on.
but it's patterns. We run patterns.
Yeah.
Normally, somebody who struggles to say no to things, they become people pleasers.
Yeah.
But what we have to explore is where it came from. It tends to stem from a conditional love.
Yeah.
It's hard to say, but it's difficult to approach the subject, and it's a very delicate topic of conversation. But if you've learned that you only have value, or you are going to be loved, secure, safe through doing stuff for others, saying no, it's not just saying no, it's a threat to existence.
Yes.
So you're afraid you might die. And this is I'm not talking when you're 20.
No.
'Cause when you're 10, the pattern's already established. It starts when you're still a child, a toddler.
Yeah.
Oh, don't cry, or so you cannot have emotions. You cannot do. If you behave in a certain way, you're not loved. So all this, that's what's up to happen. Late, and you're trying to change, and you don't understand that it all stems from your childhood and the patterns of how you were loved. It's a very tough, difficult to approach.
You need to start having those conversations, don't you?
Yeah, and then we have to reframe what a no is, because we tend to see the no as a rejection to somebody else.
Yeah.
And because we see it as a threat to us, we don't feel safe to do it. So when you start to reframe a no, there's a sentence that I always say that when you renounce something, when you choose something, you renounce something else. So we normally tend to focus on the thing we renounce when you say no, but we have to focus on what we're choosing.
Oh, yeah.
So when you're saying no to whatever somebody's asking of you, you're actually saying yes to something else.
Yes. Yeah.
And whenever something, arises and you feel like, oh, I wish I could stay home, I want to read a book, I don't feel like doing this, focus on that to say the no.
Yes.
Because then you're shifting your attention to what you're saying yes to.
Yes.
And it makes it a lot easier, because you're not saying no, you're saying yes to something else.
Yes, that's a great reframing.
It's a great way to start to get rid of this pattern, because it's a very difficult, it's ingrained.
It's very deep. That resonates with me a lot, because I know that a lot of my value has been conditioned to achievements and to doing well, whatever that looks like. And so I know that whenever I guess I do anything, almost the pattern that starts playing is, but you have to succeed at it, or you can't fail at it. Either one.
Because it's threatening to fail.
Yes. Yeah. And that's where, when I sit there and go, no, but are you really threatened right now? And I look around and go, no, I'm really not. I could be really bad at this and it'll be absolutely fine. It makes me feel better. My nervous system calms down and I do it and have fun with it. So
I really do relate to what you're saying, because I had the same UFOA situation. And I've learned to get rid of this need to excel at everything through clowning.
Yes, I love this. Oh, you must watch Dr. Gus's show on clowning, hospital clowning. It is absolutely brilliant.
Yeah, because you have to accept that being a complete failure is just as valued.
Yes.
Like it is valued. There is so much value in failing. Because you don't learn or grow through success.
Yes, I know. Yep, absolutely.
And when you understand that, I'm like, oh, I'm up for anything. And if I fail, I look at the lesson.
Yes.
Not at how much I failed or the blame, the guilt. No, what can I learn from this experience? And then you shift the way you approach things, because life gets a lot easier. It
really does, because it opens up so many new experiences when you're not feeling I have to be brilliant at absolutely everything. And it just takes off so much pressure. It's brilliant. Yes. Okay, now, what about, so let's stick with failure.
Yeah.
Oh no, because now this sounds like I'm calling my patients failures, my clients failures. I'm not. What about the client who has been, seeing you regularly over the year, no progress? Just no progress. They say they're going to do it, and then the next week comes and there's a reason why they haven't done it, and you explore it, and then you set new goals. Next week, still haven't done it, and it's just gone on, and then after a year you've kind of gone, but we're in the same place. This is more for practitioners. What do we do then?
I think the most important thing is to start a conversation by setting the scene. So every time you start a conversation that you know is an important one, you should start by framing it as it is.
Right.
So sit down with them and say, we're going to have a very important conversation today, and it might be difficult to talk about it, but we need to have it. When you came, these were the goals.
Yeah.
We are 1, 2, 3 years into this. Do you feel you're having the best out of this? So are you achieving the goals you were looking for? Because from my perspective, it doesn't seem like you were going anywhere.
Yeah.
and then have a conversation. Like I had this conversation with a friend who's a psychologist, and she said she had a patient exactly like that, and we were talking about how to approach it. And the best thing was to sit them down, ask what is the purpose behind coming to those sessions, because it might have changed.
Yes, that's true. And you're working on
working on something.
Yes.
And
yes.
As professionals, we do want to see result.
Yeah.
And sometimes we have to actually see what they're looking for. But I had that happen with one client. Because my sessions tend to be brief.
Yes.
I had to change the way I approached my work so that I could manage what he was bringing to the table.
Yeah.
And we changed completely what he was looking for. We changed everything. And at some point when we got to the goals he wanted, I had this conversation with him. We achieved what you were looking for. You came, wanting this, and that. Yeah. And now you have this, and that already.
Yes.
Do you have any other reasons for us to continue this relationship, this partnership, as, client and therapist? And I realized there and then that his goal was to still have a safe place to talk about things where he didn't feel he had. So that
then it
releases the pressure from us to say, okay, because I'm working on trying to get to results, and I feel like you're stuck, but you're not stuck. You just need the space to feel safe and talk. So the best way is to have this talk with them.
Yeah.
Maybe they just need a safe place to come and talk because they don't have it anywhere else.
Yes.
And it's okay if that's what they want,
Yeah.
and you are willing to provide this support. Okay. If not, maybe it's time to reassess what are the goals,
where we are.
How can we stop little by little? And
now, this is all going to sound really awful. So one client I have, actually, I think I need to have that conversation because I think he's scrabbling around for things to ask me about to help him with, because I just think he needs a safe space. He doesn't have that.
Yeah.
He's a carer. He's stressful work environment. There's no one he can really talk to. So I think that will relieve pressure from him, actually, knowing that he's just got the space to say whatever. But I have another client who I guess the question has been based on, where every time I do the important conversation and I make her cry, and we don't get very far because she's crying, and then because I'm quite direct, so I guess I struggle with that. And then we change the goals and we make them smaller, and then that doesn't always happen either. So I think I'm still struggling with that one.
Possibly she just wants the safe space to vent. And the idea of the conversation to her, if she comes from a place that not well-structured family, dad abandoned the family, if that's kind of the situation, she interprets, it seems like it, I don't know the situation. She might be interpreting the conversation as a threat to another loss.
To another loss, yes.
So she's like, oh my God, I just got this new partnership that it's working for me therapeutically because I have a space where I feel safe to talk.
Yeah.
And the talk triggers a survival instinct of, my God, I'm going to be abandoned again. And that's maybe why she derails.
Yeah, no, that makes a lot of sense, actually, because what I think the situation is, she struggles to have anyone who's safe. And whilst I'd always made things very clear, I'm quite blunt, I'm quite to the point, I will call things out, which she wanted, so I have been. Yes, you're absolutely right. I was different because she trusts me. And yes, gosh, oh my goodness, and this is why supervision is so important. But what about the person then who has come to you, they have been on track and they've been doing everything, and then they just had a bad week, and I mean really bad week. It's been one of those, I was all on track and then I had the sweet and then I had to have the rest of the cake. And they're beating themselves up about it. It's their own self-critical voice that's all come out.
It's a pattern. It's a pattern, especially because I work with weight loss a lot, so I see this behavior a lot. And it's, again, brain against mind. The brain just going with the flow whenever you lose focus.
Brain
the pattern comes back in. So it's trying to approach it very compassionately to say, listen, relapses are expected, during change. What I do inspire or encourage them to do is to look back into what happened during that specific moment so that we can question what was going on. So can spot what were the triggers, what was your emotional state, what had happened the previous, couple of days, maybe hours before that event, what led you to it, so that we can map it out.
Yes.
They're like, so next time, whenever this kind of conversation or this situation happens, your brain is gonna tell you, this is how we cope.
Yes.
And we've already talked that it's not the best way to do it. So let's go through all the other exercises we have available so that we can start to create a new pattern of coping mechanisms.
Yeah, that we've got a new blueprint that you have to make, but without seeing what the old one was, it's really difficult to put that new one on.
Yeah. Also, curiosity. This is a very interesting one. I read this recently. That curiosity also spikes dopamine.
Yeah.
So whenever you have,
that's interesting,
you
isn't
have
it?
like a craving, or you feel like you're having like reenact a pattern that you shouldn't be doing, try to be curious about what's happening, because that might give you the relief you're looking for before you actually surrender.
Yes, yes. And I love curiosity, because for me, it's the gap between the silver lining and where we are at the moment, because it's so hard when somebody is really down. Oh, look on the bright side, what makes you happy? It's no, they can't get there. But actually stepping up onto, so what's going on? What's happening here? Why did this come about? That curiosity gives you that bridge, and once you're on that bridge, it's a lot easier to then go on to
the next one.
Now, how can I feel grateful, or how can I feel a more positive emotion?
Exactly.
Love it. Oh, this conversation is brilliant. It's just so fascinating. We are keeping Dr. Gus, and we will be back after some tips to tools to thrive, in fact, from our guest experts.
I think brain dump is the most important thing you can do. I work with my coaching through 5 different life categories. One is personality and character, as in you as a person. Second one is your health and well-being. Third one is relationship and connections. Fourth is business, career, or money, and is quality of life. So if you can narrow down, write a list like a spreadsheet with all these categories, and then write down where you are in your life on these categories and where you want to be. And what steps do you take from where you are to where you want to be. So let's say you want to have toned body, for example, but you're not doing exercise. Then you know, okay, if I start walking 10 minutes a day, that'll take me it's a start. Like when I started my yoga practice a few years ago, I did 5 minutes in the morning and 5 in the evening. And before I knew it became like a daily practice for 1 hour. And then within 2 months, I had dropped 3 sizes. And it wasn't even like I went to the gym and changed the diet. I was still the same. But because I dedicated that little bit of time to myself, which I owe to myself to look after myself, it was a change. But it has to come from within. So brain dumping is so important, because it also makes you aware of, sometimes we hold on to so many things in our brain. It's like recycle, like the hamster wheel. So until you get that out on paper, you might think like, oh, I got so much to do. And you write everything down and check the paper like, oh, I haven't been brain about this. I didn't know I need this. I've done it so a long time ago. So because we never ever go through our list, we empty our brain and we just recycle the thoughts and we get overwhelmed. And that's also a reason why we're always stressed out. So brain dumping and the life category things is a perfect start.
Welcome back to Mental Health Matters After Hours. We are having a fascinating conversation from one practitioner to another, and it's great because it's helping me. It's going to help my clients. I can see that happening. But hopefully this conversation is helping you make the changes that you want to make. And we've been looking at the motivations to change. We've been looking at the barriers. And now we're going to look at your area of work, which is hypnotherapy, Dr. Gus. Now, I know you were a GP, and I know the reasons that you went into private clinical hypnotherapy is because you just weren't having the time with people as a GP.
Yeah.
And it's lovely to hear a practitioner who has challenged the system and said, well, I'm going to do it this way. But it's really sad because, I think you would have been a great GP.
I still miss it. I'm not going to lie. I have like this very toxic relationship with medicine. I love it, and at the same time, I don't want to be with them. If you feel like torn apart, like I want to go back, but I don't want you anymore. It's difficult.
Yeah. But it's great to have your expertise from both of your practices, really. And let's focus on hypnotherapy, because I know it can work for people where all sorts of talking therapies have failed. And people have come to you saying, I don't do therapy, it doesn't work, and yet they'll get results. So what is so special about hypnotherapy, or maybe what is so special about the third wave therapies, where talking therapy, more the second wave, it just doesn't work so well?
Well, hypnotherapy, it has a lot of myths about it, and I don't think the films help.
No, you're not there with a clock, are you?
So please stop with the films, they're not helping. But the idea behind it is to relax the mind, to have access to the subconscious mind. So just to give it an overall explanation of how we work, we have the conscious mind and the subconscious. On our day-to-day basis, we live 95 to 99% of the day on the subconscious.
Wow.
We run patterns. You're having thoughts that you've had yesterday, the day before, and they come and go. So until we change what's in there, the pattern's going to stick.
Yes.
Because as I said, the brain wants to save energy.
Yes.
So if it works this way, we're going to keep it, even if it's harmful. That's the problem. And what we do with hypnotherapy is that we induce, so it's therapy through hypnosis.
Yes.
So we use hypnosis to achieve therapeutical results. So we use hypnosis, which is inducing someone into a state, which is called trance state or hypnotic state, which is a natural state to everyone.
Yes.
So people go, oh, I've never been hypnotized, but you go into that state every single day.
Yeah.
Every single day. You just don't know it. But you know, when you're driving, you're like, oh, suddenly I'm at work.
Yeah.
Yeah, and you were thinking so many things. You didn't see cars, you didn't see people, but you drove there.
We call it
safely.
autopilot.
Yeah, autopilot. The autopilot is run by the subconscious
The
mind.
pattern. Ah.
And that's where the patterns are. So what we do is like we relax the conscious mind and we have direct access to the subconscious. They get more suggestive. We no longer have the conscious mind as a barrier. And if the person wants those changes, we talk about what are the small changes we're going to implement so we can change the subconscious, the patterns in there. And then they live it.
Yes.
Little by little, a little bit of effort here and there. And the struggle to make the change disappears.
Yes.
And the funny thing is, people normally don't notice them until I call them out.
How funny.
Because I think we're wired to complain.
Yeah.
It's a very humane.
Yeah, we are. I think we are. It's a
Why do we do
bonding
that?
mechanism.
Yeah, like, oh my God, the day is awful.
Yeah.
Well, I've been in the UK for 5 years now, so I know we start any conversation by complaining about the weather. Even if it's sunny, it's too hot. If it's cold, it's too cold.
Yeah.
And it's ingrained in our, societal behaviors, and I get it. But because of that, we struggle to realize what's going well.
Yeah.
So sometimes I have to step in and say, okay, so we are seeing changes because you didn't complain about this, this, and that. Oh, yeah.
I love it.
So, yeah, that's why it works so fast.
And actually, I want to say, just to repeat something that you said, it is therapy through hypnosis. That phrase has been used by, we've got somebody who focuses on performing artists, and she also said things like drama therapy and dance therapy, music therapy. It is therapy using the modality of dance, music, or you're trained as a therapist, you're trained as a clinician. And so when you've got dancers trying to do mental health, it doesn't work because they're trained dancers. Yeah. And it is about remembering the word therapist has weight and it has integrity and it has training attached to it. So I'm really glad you made that extra point, as well as, of course, explaining why that works. And I love that because the idea of relaxing the brain makes such a difference on a very small scale. My dog is quite traumatized. He's had an awful upbringing for sort of 10 years. He was bullied by his littermates and his mother, which was worse. And one of the things that relaxes him is licking. And I got him a licky mat. So you pour, sort of pumpkin and whatever. And what I've noticed is letting him have the licky mat, he's stopped doing some of his slightly weirder traumatic behaviours, he's calmer. We're able to just almost, he remembers, oh, I can get up on the bed by myself. I can go up the stairs by myself, just because he's had that time to relax. And it is about getting rid of the patterns.
Yeah, and finding what fits that specific person or dog.
Yeah, but just without him doing that, he will just look at me and bark at me because he can't get up on the sofa. You can get up on the sofa. Once he's been licking, he can get up on the sofa, no problem. It's that relaxed frame of mind. Yeah. It's brilliant. Sorry to me. I know we're not all dogs. I get that.
No, but it's a great analogy. It helps.
So how quickly, now with my dog, I noticed it pretty much within 2 days, but how quickly do you notice changes after hypnotherapy, or is that horses for courses? Kind of?
It changes from one person to the other.
Yeah.
People are, individuals. We're all different. Sure. But normally, within the next hour or 2 days, you already seeing change.
Yeah.
In the way you think, the way you feel, the way you behave, and little things. That's the thing. I have to call them out.
Yes.
Because when everything is going well, nobody notices what you've achieved. When something goes wrong, it's very easy to, they said this, but all the other, 15 and a half hours you have in the day, nothing happened.
Yes.
But the one bad thing, we make it huge.
Yeah.
So I have to train them to see. So my second session of all my, after the first session, I always start like, what are the wins of the week?
Yes.
What happened that was great?
Yeah.
So that we can start to actually value the things that are going well. Because there are many things changing.
Yeah.
But the results are fast. They come very quickly.
And it's really interesting because just using a mindfulness relaxation before my sessions, that's something I've added on now with clients. It really puts them in a good frame of mind to have a conversation they want to have. They're not still sat there with, this happened and I just want to focus on this particular thing because I'm really angry about it. They can still be angry, but they realise that that's one thing out of many things that they want to talk about. So I think that relaxation is so important. But are there people that hypnotherapy is not suitable for, or maybe not suitable for yet?
You have to want it to work. Yeah. So you have to believe in it. You want to make the change. There are people, that want change, but doesn't want to make change.
Yeah. That's going back to our beginning point.
So we need to make sure, yes, there are changes that are going to happen, but if you don't make a bit of effort to play them out, then it's not going to happen. I always use this analogy of there's always this beautiful castle you always wanted to access, but it's being blocked. There's a huge gate and you don't have the keys. Conscious mind. And then I open the gates. I help you to open the gates. The gates are open. You can visit, you can explore the whole castle. But if you don't make the slight effort to actually
go to the gate,
then it's not on me. That's why I say you have to start every therapy session, the first especially, setting out what are the realistic outcomes you can get from it and what our roles are. I can open the gate, but if you go through it, I'm sorry.
There's nothing else I can do.
I want you to feel great, but you still want to do the same things. You want to implement any of the changes, any of the exercises that I'm bringing forward.
So then it's revise the goal, isn't it?
Exactly.
What is it you actually want?
So it's not going to work if you don't want to make change. If you want change, great. You might relax. But you'll struggle to see any change. They will come, but you will see less of it.
I love
if you're interested in making change, it's going to be huge.
Yes.
Yeah, and it's not, I have to make this very clear, for those who've had any psychiatric diagnosis that come with psychosis as a symptom. So if you take mood stabilizers, or you have bipolar personality or mood disorders, these could worsen your condition.
Yes.
So they are not to be done on you if you have any of those.
Yeah, and again, it's about being honest and being... because a therapist is there to help you. And if you're not honest, it's like going to the doctor and not telling them all of your problems and then wondering why you're still hurting. So we need that honest relationship, and practitioners rely on you to be honest when you come through their doors as well.
Yeah, exactly.
So this has been such a fascinating conversation. Dr. Gus, where can we learn more about you or sign up for your session?
Well, you can find me on Google. You can just Google GusChaves.com or on Instagram at Dr. Gus Chaves.
And I love your Instagram because you do such great reels. They're really conversational as well, and they're easy to pick up. And I watch them and I think, oh, I do that. And it's just a little reminder, a conscious reminder of stop activating that pattern. Yeah. And it's absolutely brilliant. We're going to keep you with us, Dr. Gus, because it is just you and me today. So, but we will head over to Test the Trend.
So most people, when they want to make change, they think of these huge changes, massive changes that they don't want to, make. They tend to start by overcommitting to too much in little time. We know what happens because we've all been there. We fail in less than 2 weeks because it's too much to change in such a short amount of space. So my tip for you is to commit to one small change, even if it's just 5 minutes a day, that it's doable, achievable, and then you can actually commit to it, to do it daily. Once you do that, you start to establish a better relationship with yourself, because so far you have been failing to yourself. So if you had a friend that would never show up, at some point you would question if you could trust them. So right now, if you've been overcommitting, you don't trust yourself. And we need to reestablish that relationship with yourself. So going one small thing, 5 minutes a day, 2 pages of a book, whatever it is, it's the small things that are going to pile up to big changes. And that habit will create a new identity, and that identity will come with new patterns, and then the change will just establish, and that's going to be the new you. The massive change you want, start with small steps.
Well, welcome back to the last part of Mental Health Matters. This is always my favourite time because I like reflecting on all the things that we've talked about. And one of the key things, it was actually in the Test the Trend segment that you just recorded with us. It's that relationship with yourself. And I hadn't even thought that when you say, I'm going to do X, Y, and Z, and then you don't do it, you have broken a relationship with yourself. You've worsened that relationship with yourself, and you need to build that up again. And it's not, in my mind, I guess it's not just trusting yourself. For me, it's, I guess, and this is the pattern coming out, being someone I can trust. I need to have that almost righteousness.
I think that's it. When we talk about relationships in general, we always say what makes a couple stay together because they trust each other. Yes. And if you don't trust yourself, so how can you commit to anything? How can you make any changes? Because like everything you set up, it's not set up to fail because you know you're not going to be able to commit. Yeah. So reestablishing that connection with that relationship with yourself. Yeah. It's like fundamental for you to move on in any area of your life. Because then you start committing little by bit by bit on the things that you want to, achieve. It will get you there.
I think that's such a big thing. That's such an important thing. And the other thing that really resonates is the UFO. It's the I love it. I absolutely love it. Underfulfilled overachiever. Yeah. Spot on. But it is again about asking why. Why am I doing this? And actually, do I even need to do this? Because you might be achieving because you're running on an old pattern, and that can be almost blocking your brain from making any other changes because you're so almost
blind,
conditioned to just do this other thing that you don't even like doing anyway, or whatever it might be. It's just there's so many little moments. What for you has been one of the most helpful things in making changes on your own journey?
I think I think we share a bit of the UFOA condition. And at some point I had to stop avoiding the difficult inner conversation.
Yeah.
Because I used to also externalize
Yeah.
my achievements, like my inner fulfillment, with external factors.
Yes, yes.
It's very difficult.
Yes.
Because you never get there.
Yeah, yep.
You're
And
always unfulfilled. You don't feel like you're doing enough. And then you get to a point where you burn out.
yeah.
And you still don't feel like you've got it. And I think you have to at some point. But the most difficult part for me was to be honest with myself and say, okay, you're vulnerable. You're not perfect. You're flawed. And it's okay.
Yes.
You don't have to do everything to be valued, to be loved, to be deserving
Yeah.
of love or respect. You can just be you and find your way. And it's okay to say no.
Yeah.
Because you're saying yes to something else.
Oh my goodness, on that. Thank you for tuning in, and from all of us here at Mental Health Matters After Hours, good night.